There is panic around the world over what could be in store this winter. Israeli health experts have repeatedly been sounding alarm bells, issuing a dire warning that the twin virus catastrophes, coronavirus and the flu virus, could lead to a major public health disaster, causing a spike in cases, overrunning hospitals, and leading to a meteoric jump in deaths. Winter is cold. People are indoors. It's easier to get sick. But a surprising and frankly positive statistic today here in Israel, despite the fear, despite anxiety, no Israeli citizen as of yet has been diagnosed with the flu. At this exact time last year, 18% of flu tests were already coming back positive, dozens of individual cases of the flu. But so far this year, 0 positive tests. With us now is Dr. Daniela Cohen. She's the head of family medicine for Maccabi Healthcare. Doctor, good to see you again. I want to note, of course, we're not suggesting that no one in Israel is going to get the flu, but it is worth noting that by this time 1 year ago, the flu was here, and a high percentage of cases were being confirmed. Now it's 0. Any possible reason why that is?
Hi, Jeff. Yeah, that's absolutely right. I remember last year there was really a scare regarding, or not a scare, but we were quite concerned with flu. And this year we haven't even seen one recorded episode of flu virus in Israel, according to the Sentinel clinics that we have. And I have to say that in general, upper respiratory disease seems to be lower than it was last year, not just the flu. And there might be several reasons for this. It could be because people are wearing the face masks and are keeping social distance, and really are staying more in their homes. Also, they're coming to clinics less in general, but also people are really going to get the flu jab, the flu vaccine, much more than they were before.
What are you seeing at Maccabi, one of the major, healthcare providers?
I think those are the reasons, really.
Are there people, is there a big interest in Maccabi of people wanting the flu vaccine this year, and they didn't want it in years past, but they realize the risk this year?
Yeah, I mean, a lot more people now are calling their physicians, coming to the clinics wanting the flu vaccination. But according to the health ministry's guidelines, we really started rolling them out only for the chronic patients and the patients in at-risk groups. And a lot of patients that otherwise not in the risk groups did want to come and have the vaccination, but we couldn't give it to them in the beginning, the first month of October and the beginning of November. However, from last week, we have opened it up to the general population. So now anybody who wants to come and have a flu vaccination can actually do that. But yes, there was a spike in people coming over, and we expected this spike actually because of Corona.